Welcome to That Business Show 2.0 with your host, Jamie Maloney, where business becomes show business. Today, we're going to be talking about addiction treatment with Executive Director of Second Chance Counseling Service, Megan Peterson. So, Megan, welcome to the program today.
Thanks so much for having me.
So you have 15 years of experience as a counselor in addiction treatment, a pharmaceutical rep. Tell us a little bit more about your background before we get into the discussion.
Sure. Well, I went to school. I didn't think I would land in this field, actually. I went to school. I was a criminal justice major. And actually, I had dreams to go into the FBI.
All right.
But right after school, I got my first job in a maximum security juvenile detention facility. And at that point in time, they needed a lot of counselors on the floor. And I realized that I had a knack for it. And it was something that was very, very easy for me. It became very easy and not very difficult to interact with other people and establish trust and rapport and kind of want to help them and guide them. So from that point, I just kind of fell into lots of other drug and alcohol counseling positions, and I never went back.
So how prevalent is the problem of addiction in our society? I, fortunately enough, have been able to dodge that both personally and, within the people closest to me. I've never really been, involved with, having somebody with an addictive personality. But, from your standpoint, how problematic is this?
I mean, we have an epidemic right now, and lots of people are talking about that. In fact, on the Today Show yesterday, they had a huge article or a huge news piece just about Ohio, about all the deaths that are happening from fentanyl in one county in particular in Ohio. So we, I'm not quite sure. Well, I know some of the reasons that it led up to this point, but we're definitely dealing with a national crisis. I actually just went to a convention 2 days ago, and the woman's topic is that addiction is the new terrorist, which obviously when we hear that word, it's a pretty powerful word and it kind of throws people off. But literally more people in this country right now are dying than what they have, previously in terrorist acts, even on this country. So, we have our own kind of terrorist right now in the United States, and it is addiction, and we need to find better ways that we can treat it and help individuals.
I caught that piece on fentanyl. That was the first time I had ever heard of fentanyl. Still don't even know really what it is. Is that something similar to like methamphetamine? What is fentanyl?
So fentanyl is an opiate-based, basically treatment for pain. So it would be, like your pain relievers would be like fentanyl, morphine, Oxycontin, oxycodone.
Right.
Percocet. So all those drugs are full agonists, and they were created to basically help people through pain, through surgeries, through different types of things that may ail them or they may be injured. So fentanyl is one of them, but it's one of the most powerful ones. And now a lot of the drugs are being cut with it. So people that are getting heroin off the street are thinking that they're getting heroin and they're injecting that, and they're not. They're actually getting straight fentanyl, and it's killing hundreds and thousands of people right now.
I'm in Tampa Bay, Florida, and I'm sure you're probably familiar with the painkiller crisis that
Yep.
Florida had. For people that aren't familiar
Yes.
with it, basically there are pain clinics on every street, and people could walk in and out of these facilities and get these painkillers, and it created a lot of addicted people. And I was talking to another addiction medicine specialist on this program, and he said, yes, Florida did solve the problem of these excessive pain clinics, but it's created a secondary problem in that these people that were addicted are now going to heroin. Are you seeing that same trend?
Yeah, absolutely. Nobody that gets addicted says that I want to be a heroin addict. I mean, I don't think I've ever met a heroin addict that said that they wanted to be a heroin addict. So most times it starts where they get medication just to treat their pain, and they have legitimate pain after a surgery. And then it gets to a point where they're taking more and more of the drug, but now they're taking it not just for pain, but possibly to cope with other things that are going on in their life. And now they go back to their doctor and they're continuously asking for more and more of this medication. And the doctor gets to a point where he pumps the brakes and he's like, you know what, you've had enough, and I really don't see where your pain coincides with the amount of medication that you need, and then they end up kicking the patient out or referring them to someplace else. So it's either now the patient's on the street and now they don't have the medication that was relieving their withdrawal symptoms and taking care of their pain, or now they just refer them to someplace else, and now they just start all over again. So it's like this vicious cycle that they're not really getting the help that they need. Oftentimes in those instances, especially if it's a primary care doctor, they'll just refer them to a pain clinic. Well, you're not addressing the addiction. You're now just giving them more pain relievers for their addiction when it's not necessarily that addiction that they're suffering with. There's a really fine line there. So it's a really cyclical thing. It's pretty sad where we're at right now.
So what are the solutions to people that are dealing with chronic pain? I myself have had, lower back pain on and off through my life. Fortunately, it's never been severe, but, I found relief in exercising, just in general, just exercising and the release of endorphins, but it would only last for a couple hours and the ache would come back. But again, fortunately for me, it was never severe like the way some people describe it. For people that are really in constant pain, what are the solutions then for them?
So there's not one thing, there's not one magic pill out there, or else everybody would be using it at this point. So everybody's chemical makeup and everybody's DNA is different. So what works for one is not necessarily going to work for the other, but that doesn't necessarily mean that you should just try one thing and say, oh, that didn't work for me and I'm done and I'm not going to try anything else. So, some of the patients that come in with us that are taking pain relievers and have legitimate pain, but also are kind of on that threshold of taking too much and now, going into an addiction, we give them other options. Like you said, how about let's try exercise? Let's try the TENS unit to see if it can relieve some of that aches and pains that you have. Let's try yoga. Let's try acupuncture. Let's try massage. Let's try other things that will get your, like you said, like your dopamine release or your endorphins going. And for some people, that can even be, going out and painting or doing other activities like that you wouldn't even think about. So it's all what chemical reaction, what you do that's going to stimulate a chemical reaction within your brain to kind of help you take care of that pain at that individual time. So it's different for everybody. But I think that people should try different things before they just go to the doctor and says, okay, this isn't working anymore. I just want an automatic increase.
So what causes addiction in people? I myself, like to drink alcohol from time to time, but I've never become addicted to it. I see other people who can't even have a drink or else they can't stop drinking. Is it just some people are prone to addiction and some people aren't?
Right. Yes. So that's a lot of controversy out there as far as like if people are predispositioned or not, or if it's a thing that you can control or not. That's like a hot topic and has, been a hot topic for years now. So I do think that there are individuals, and scientific study has basically backed this, that, certain people have DNA makeup, chemical makeup. Let's say if I had mental health issues or addiction issues within my own family, that I would be more predisposed to actually having those myself or inheriting some of those. So I think that's definitely a valid thing, but that's not necessarily saying that I'm doomed either. So once you get to a point where you're using substances and you're using it to cope with other things in your life, and now they're affecting other facets in your life where you're getting in legal ramifications, or you're losing your job, or you're having situations where you're having difficulties with your family, now you've kind of crossed over to that point where you're in an addiction.
Now, how does Second Chance counseling service come into play with people? Talk to me about your program and services and how they compare maybe to traditional treatments. Elaborate for this.
Sure. So traditional treatment is so the kind of like the realm that we play in. Traditional treatment would be outpatient therapy or intensive outpatient therapy, which traditionally how that would work was patients would have to go into a facility and meet with a therapist and conduct groups within that facility in a certain timeline. So usually facilities, in fact, I worked in a lot of these facilities myself, they'd be open from 9 to 5 or 9 to 7, or, times where patients can kind of get in on some of those days, but the way that we live today, it's not as conducive as what it once was. We have a lot of other barriers that we either put up for ourselves or that we legitimately have. So some of those could be transportation, or they could be jobs, or they could be, family expectations that you have kids that you need to take care of and things like that. So it's tough. It's tough to get to therapy. We have 24 million, people that are addicted in this country, and only 8 that are getting help. That number is ridiculous. There's no reason to have a number like that low. So what we do is we're an online teletherapy platform. So we have patients meet with our therapists at their convenience. So if a patient wants to meet with our therapist at 5 o'clock in the morning before they leave their house to go to work, then that can happen. If they want to meet with their therapist at lunchtime on their lunch break because, they're crazy busy and that's when they can carve out time, then that can happen. Or if you have the mom that puts the kids to bed at, 9 o'clock at night and wants to talk to their therapist at 10, then that can happen. So we're kind of trying to take out some of those barriers and those specific, guidelines that traditional facilities will kind of put up, and make it accommodating to people when they need it, not
Okay,
just.
so this is a telemedicine service. Do you have a physical location in certain areas, or is it strictly telemedicine?
No, it's strictly telemedicine. We have no physical locations. It's all done via remote on a computer or on a smartphone. As long as a patient has a Wi-Fi connection, they can meet with their therapist.
Now, you have 15 years experience in treating and working with addicted people. Does it make a difference whether they're sitting in an office with somebody or in a treatment room versus over the phone? Do you think the connection is still the same?
I think so, because I've been doing this for a while. I think sometimes actually I've gotten a greater result because now I'm meeting with the patient in their own environment. So I've actually gotten more authentic of a patient because they're comfortable. A lot of the times when patients go to facilities or doctor's offices or things like that, they kind of put up a front because they're going into another place. Versus when you're at your home, like, you're laid back,
right,
and you're a little bit more comfortable. So, or when you're in your office or in your car, because you're in your own environment. And so other than the barrier of, like, obviously if a patient, was really having a difficult time and needed a hug, I couldn't reach out and give them a hug at that time. I don't find that there's been any other barriers. I actually find that I get more real of a patient in front of me that wants help.
Currently talking to Megan Peterson, Executive Director for Second Chance Counseling Service, a telemedicine provider for those addicted with addicted to substances such as painkillers or heroin or alcohol. We're going to talk a little bit more with her when we come back from the break. I want to get into some of the barriers to treatment that she touched on briefly here in this segment. And if you could use their services, reach out to them. secondchancecounselingservice.com, number 2ND, secondchancecounselingservice.com. You're listening to That Business Show 2.0 with your host, Jamie Maloney, where business becomes show business.
Hi, welcome to Yeager's. We just want to take a minute and show you what we're all about. At Yeager's, our primary business is hardwood flooring, although we are remodelers for kitchen, bath, and general construction. We operate a fleet of shop-at-home vans that have all the flooring type products, hardwood flooring, laminate flooring, tiles, stone, what have you. So we're able to come out first with products in our vehicles and take a look at the setting, how the colors will work, and then to be able to come up with some options and ideas for you. If that's not good enough, we have a large distribution center that we inventory product and have a nice display area.
Welcome back to That Business Show 2.0 with your host, Jamie Maloney, where business becomes show business. New episodes each weekday morning, 9 a.m., thatbusinessnetwork.com, made available on iTunes and on YouTube. Today we're talking about addiction treatment with Megan Peterson. She is Executive Director at Second Chance Counseling Service. Learn more at that website, secondchancecounselingservice.com. And Megan, in that last segment, you're touching a little bit on barriers to treatment. So my first question is, what is the greatest barrier to treatment? Is it with the person who is addicted themselves and getting them to admit they have a problem? Or is it with their sphere of influence, the enablers that you hear so much about?
Well, you know what? That's a really great question, actually. I think you could almost say sometimes that could be 50-50. But typically, in the end, the patient needs to make that decision that they're willing to make some changes, because you can't forcibly make anybody to do anything. You can think that you can, but in all reality, you can't. We're in control of ourselves at all times, and ultimately, we make that final decision. So I think a lot of it lies within the patients. Patients will set up barriers for themselves. And then, yes, when you have, a lot of family involvement, a lot of things like that, you also have the enabling factor that comes into play where, people will enable the addiction or be in denial and not really address that there's a legitimate problem as well. And that can be a barrier.
Now, when they have come to you, have they admitted to themselves that they have a problem, or are they sometimes being forced into that situation by their loved ones? Do you get a mix of people at various levels of that acceptance, denial phase that people go through?
I do get a mix. In fact, one of the first patients that we took on, or that I took on personally, that I was, doing therapy with, I really applaud his honesty, but he came on and he said, I'm only doing this so that my parents and my family's happy, so that I can go back out when I'm done and continue to use. And I was like, okay, you know what? I appreciate your honesty and I can work with that. So, let's talk about why. Like, why are some of those reasons then? What did you really, really like about using so much that you're that compelled to go back and do it? And we worked together for, I want to say it was like the 3-month mark that he actually kind of circled back around and said, you know what, I want to be clean now, and I don't want to go back to use. And then that was further stimulated a conversation as to, okay, now why the change? What happened in that 3 months that led you to kind of have that epiphany that you didn't want to do this anymore? So I think as long as you're getting honesty, which obviously sometimes that can be really challenging too, because people have to let down their guard and realize that they're not going to be judged and stigmatized for being honest and really being who they are. But I think that if you have that, then you can work with something and you kind of know what direction you can go in.
How do you engage with the enablers? Because they have such an important role in stopping addicts just by, enabling their behavior, saying, okay, I understand. They can't be so understanding. And so is part of your service also reaching out to them? And are you always successful in getting to talk with them too?
No, yes, absolutely. Part of what we do is to reach out to families that are having a difficult time dealing with situations. Every therapist has their different way of doing it, though. So obviously we have many different therapists that have, utilize many different techniques. I'm more of a blunt person. So, I'll kind of lay it down like it is. And if you don't like it, that's fine. But at least I'm being honest with you and we know what we need to do. Sometimes it's a challenge, though. A lot of people don't like to hear that what they're doing could be wrong and could be really having a substantial factor in feeding the addiction, of their loved one. And it's tough. It's really tough. I just had a conference this weekend, and I actually checked into my hotel, and as I was checking into the hotel, a mom was talking to me about her son. She noticed the shirt and was asking about what I did, and she asked, and I told her, and she's like, do you mind talking with my son, because he's got a problem, and I'm literally at the point that I'm going to kick him out because I can't enable him to do this anymore. And we had a really, long conversation about that. And at the end, I was like, I applaud you, because I know that you're making really difficult decisions. And I know that as a mom and as a fellow mom, that they're really hard to make, but you're doing the right thing. And, we're here to support you if you need that as well. So we kind of get it in all different directions. It just depends on the person that kind of picks up the phone that day and wants help. But each individual is dealt with differently on a case-by-case basis.
A lot of stuff in the news lately about marijuana being allowed, as a medical, treatment, recreational use in Colorado. You obviously are in the front lines of this. What do you say to the people that say marijuana is a recreational drug, it should be legalized, it's not a gateway drug? How do you say?
So So the woman that I talked to that I just mentioned yesterday, when I met her at the hotel, her son was smoking marijuana. So the conversation, I'll just reiterate kind of the conversation that I had with her, because it's really interesting that you just asked about that. So there's been scientific studies that are done right now that marijuana is not like the marijuana that we had, quote unquote, back in the day. It's a lot stronger. It's a lot more potent. It's a lot more powerful. And there's been science that's kind of backing this. So I think that, they've actually come out and said that people that utilize it once, it's sending patients into psychotic episodes, which that's pretty crazy. That's pretty powerful study and research right there. So I think that we need to kind of take it in stride and really take a look at how it's being utilized. Again, this particular patient got legal and legal troubles from his marijuana use, and he did experience some depression and anxiety that was going on with that as well. So he has absolutely crossed over to that. Now I have an addiction to the substance and I need to get help for it, because it's not just recreational. I'm now using it to cope, versus it's being utilized medically too, where it is helping people. It's helping, kids with seizures and helping them as well. So I think that there's a line in the middle where it can kind of fit on both sides, but I think we really need to be cautious where that line is and how it needs to fit in our society as well, because obviously you don't want a lot of negative consequences from it, but also if it continues to help people medically and that's being, scientifically backed and proven, then obviously we want to look at that as well. So I think that a lot of people are pro and con. It's definitely going to be a hot topic, I think, for years to come.
And the people that you find that are addicted to heroin, cocaine, and painkillers, are they oftentimes have started with marijuana?
It used to be that way. Not anymore. No.
I think, is it painkillers
No,
are kind of in a
like
class by themselves, right?
Yeah.
People that otherwise wouldn't be
Yes.
addicted to things are getting addicted, correct? Because of back pain, accidents, things of that nature?
Well, that, and now even like our youth, back in the day when I was younger, it would be pot or alcohol that would be introduced me to, to the kind of the drug scene. But now kids are going to parties and they're having quote unquote called pill parties. And what that is they basically go into their parents' medicine cabinets and they take a bunch of pills out of that and they throw them in a bowl. And you go to this party and you pick up a handful and you take them. You don't know what you're taking. So that's pretty scary that we went from marijuana and alcohol to now having pill parties where this is kind of like the in thing to do. So it's not really that marijuana is necessarily a gateway as prevalent as what it was at one time. We're really seeing kind of the upswing and the opposite.
What are you seeing in terms of careers affecting people's addictions? You hear a lot about certain industries being very stressful, so people go in, to abuse cocaine and alcohol. Are you seeing people that later in their lives becoming addicts and people who when they're younger in their youth never touched anything?
Oh, yeah, absolutely. In fact, I was talking to somebody just from a business aspect as far as being an entrepreneur, because this is not easy. No one ever prepared me for this. We were talking, I was like, this is really hard. And I can completely understand how people that get into being your own business owner could fall down that rabbit hole of utilizing like Ritalin to keep yourself up and to keep pushing forward, or cocaine or other substances. So, and we were actually talking about how it's a big problem. It's a big problem, even just for small business owners or business owners alike, to be utilizing medications to kind of help them push through. So I would say you're not safe ever, right? I thought that when I was younger, actually, even when I worked at a methadone clinic, I specifically remember the specific moment, because I didn't take drugs when I was a kid. I was going to go to the FBI. So you don't go in the FBI telling them that you use drugs, right? So I never took anything. And I remember sitting in the methadone clinic and I had a patient there that had a back injury and he was prescribed narcotics. And he just got to a point that he needed more and more and more until they cut him off. And then he started buying tablets on the street and they got too expensive and he went down and ended up having to inject heroin. And I remember him telling that story. And I'm actually, I'm a therapist. I'm sitting there and I started to cry. And everybody in the group is kind of looking at me. And I said, I just realized at this moment that it doesn't matter what choices I made up to this point, I'm still not safe.
Yeah.
Like, nobody's safe. This can really happen to anybody. So if I had a surgery and I didn't really monitor and I wasn't really careful with what I was taking and what I was doing, like, I'm still just as susceptible now as what I was when I was a young kid, and thought that I kind of got away from that and I avoided it. So it really can happen to anybody.
And you really feel for the people that are suffering from legitimate pain.
Yeah.
And I think I asked you this already, but what can they do other than just exercise? And are there replacement pills coming on the market that are taking the place of opiates that are non-addictive but provide pain relief?
There's other things that are coming out. I know. What was it? Butrans just came out. That was specifically, it's a form of buprenorphine, but it came out to specifically address pain. So they are looking at other medications that can help treat pain without necessarily being a narcotic. But I think we're a ways away before we get there. So I think patients just need to link with a therapist and talk with other options and other things that they can try. And it's really going to be a process of elimination. But I also think that people need to be a united front. They need to be a team. So oftentimes you have the therapist, then you have the doctor, then you have the patient, you have all these other people, but they don't talk to each other. They don't communicate. I think we need to communicate more on behalf of the patient. So if we're all talking about the same issue, and that is like, how can we treat your pain, and we're all looking at alternatives, then in the end, that's what's in the best interest for the patient.
Very good. Megan Peterson, Executive Director of Second Chance Counseling Service. Thank you so much for being with us on the program today.
Thank you for having me.
And again, they are a telemedicine service. So if you're suffering from addiction, you can get on the phone and talk with them from the comfort of your own home. Just go to secondchancecounselingservice.com. Phone number 570-691-6347. 570-691-6347. New episodes of this program each weekday morning at 9 a.m. on thatbusinessnetwork.com. Please find and subscribe to us on iTunes and on YouTube. So again, you've been listening to That Business Show 2.0. I'm your host, Jamie Maloney, where business becomes show business.